I think we are live now. Uh, Very good evening, everyone. This is me, Rohan Tripathi from iNovocare Health Hub Solutions. As a part of our year-long, the set of 12 programs, educational series, webinars on medicinal adherence, and we have already reached the fifth program. There have already been four in the list. All are available on YouTube. Today, we are dealing with the topic that has been raging in this country for on all of the world, in fact, for the almost last one and a half of years, COVID-19. So, our today's topic is healthcare advisory adherence in the times of COVID. Also, today is a very special day. At iNovocare, we are very serious about this. Today is the World No Tobacco Day. Not when we talk of no tobacco day, we often only concentrate on cigarettes. But in a country like India, it's not only cigarettes. We have also to focus on the chewing tobacco and the other forms of tobacco intake, which are all very harmful to our health in general. And I will hope our dear doctors, our respected guests, Dr. Shambhu Samrat Samazdar and Dr. Shantanu Kumar Tripathi, in their speeches, in their talks, will also give a reference and give importance to these factors, which are also, I think, very important, and especially as COVID has a direct impact on the person's lungs, the entire cardiovascular system. I think the being today being World No Tobacco Day is of even more significance. With that, I won't uh, wait and I won't make you wait anymore. I won't stand between you and our respected speakers anymore. I will welcome Dr. Shantanu Kumar Tripathi and Dr. Shambhu Samrat Samazdar to proceed with the evening's deliberations. Thank you.
Thank you, Rohan, and welcome everybody. Welcome, Dr. Shambho, and I take this opportunity to greet all the people who are present today, this evening. And today we are going to discuss the topic that is entitled Healthcare Advisory Adherence in the times of COVID-19. We all know that for the last 1.5 years, we are passing through this global crisis, and that is a pandemic with a hitherto not very known disease that is infectious in nature, and the causative organism is a virus, is a dreaded virus, that is SARS-CoV-2. And we are, after we had the first wave, okay, which continued since in India at least from the end of January or so, the whole of the last year, and then also in the last say 5 months, the initial couple of months, say up to the first part of March, we had the feeling that we have almost conquered this pandemic. But then this tiny virus proved us wrong, and it came back with vengeance. And we are in a even worse kind of stage of the epidemic, whereby huge number of people, their lives were sacrificed, and huge number of people were infected, and the crisis is still going on, although there has been some control in the infection transmission. The number of infections, at least in the country, in the last about a week, there has been a trend towards decline, but then it is still on, and there are also concerned, that there is a possibility that we may have to again enter into another wave, that is, many people are calling a third wave. We are not too sure about what's going to happen, whether it will at all happen, the third wave, or if it happens, that how fierce it would be compared to the second. But then we must, the second wave has taught us that we must not lose our guard, and we must be well prepared. Okay, if we remain alert, possibly to a great extent we can avoid the huge catastrophe or the huge kind of toll that we have experienced during the second wave. As we are saying all these in this series of these sessions on a monthly basis that is happening, and I know Care is actually facilitating this and providing us this platform on a theme, and that is adherence. Although primarily it was based on medication adherence, but then adherence is a concept which probably goes even beyond just medication adherence. This pandemic has also taught us that when we talk of adherence, okay, in reference to any disease management, just medication adherence or appropriately following the doctor's advice on the how to take the medicines, okay, specifically. So that is extremely important. But this pandemic has taught us that might not be enough. Okay, we have to also, for the last 1.5 years, we have experienced that in fighting a otherwise unknown disease, how the whole world together they were fighting, and they were actually trying to gain knowledge and evidence so that we can actually fight this disease, not just treating the patients who are getting afflicted with this viral infection, but also we had to in parallel investigate how we can think of containing the disease, how we can probably reduce the transmission rate, okay, and what are the different strategies that we can actually adopt in reducing the transmission rate and bringing this pandemic to an end. And in this, because to start with, we didn't have much tools with us, much weapons with us. Even today, we do not have too many. We can't have the luxury of too many objective treatment intervention or preventive interventions. But then one good thing is we are armed with the vaccines now. A good number of vaccines are there, although access to the vaccines and vaccination is also another challenge that throughout the world people are facing. Okay, the pace at which the infection is transmitted and the speed at which the vaccine candidates they have been developed with great speed. Newer vaccines have come, but then to have enough number of vaccine doses produced so that most of the people, if not all the people who are vulnerable and who are otherwise eligible to get vaccinated, they get the vaccine. So that is also another challenge. Side by side, it all started from the very beginning itself. We knew that this is a virus that is more or less within a few weeks we came to know how the virus is transmitted, the mode of transmission. Although there are newer theories also have come in the last 1.5 months that it is not just the droplet infection, okay, droplet respiratory infection, but then it could also be airborne. But then some basic preventive measures, the COVID appropriate behavior we have adopted, and we are trying our best throughout the whole world. People are trying in complying with, in actually following this COVID appropriate behavior. And most of them, almost all of them have been unequivocally established that if we follow these, whether you talk of masking, whether you talk of the distancing, physical distancing, or the hand washing and hand sanitization, etc., all of them are otherwise based on hard evidence that they work. They will definitely prevent man-to-man transmission, okay, human transmission. And later on, towards the later part of the last year, we are also blessed with this advent of the vaccines, the different vaccines. In India also, we have come up with 2 vaccines at least, and the third vaccine in the name of Sputnik that has also come. The other 2 were actually Covaxin and Covishield. They come simultaneously together. In all this, in our continuous fight against COVID, okay, what emerged as very extremely important message is whatever new knowledge are getting poured or is pouring in, we all need to follow them. We need to follow them very religiously. If we talk about putting a mask, we mean it. When we say wash your hands, we mean it. When we say that we need to maintain a distance, okay, physical distancing, avoiding crowd, okay, we all mean it. But then to what extent we are actually abiding by these advices? This is what is we are talking of, the adherence, adhering to the advices. It is not just the medication adherence, and that's why the topic, probably the title of this today's discussion is the healthcare advisory adherence in a broader sense. So up till now, until the pre-pandemic time, pre-pandemic era, when you talk of adherence, we immediately refer to medication adherence. I think the pandemic has taught us just medication adherence, the concept is not that narrow. When we talk of adherence, we actually mean all sorts of healthcare advisory. There is a strong need to adhere to them if we are serious about uh, keeping away the diseases, or if we are afflicted with the disease, how we can get out of the disease quickly. So for prevention of disease, for treatment of disease, for maintaining a meaningful life, or leading a meaningful life, in all these, we need to actually abide by different advisories, and all these advisories are mostly, they are based on hard evidence. Only through investigation, through research, they have been established and validated, and then only these advisories are coming. So we need to abide by them. Yes, there in science there is always a chance, always a probability that existing advisory is likely to change with newer advisories, because as new knowledge is coming in, greater, stronger evidence is coming in. So we need to also shift gear and then adopt the newer advisory, follow the newer advisory, and this kind of adherence will only help us in taking us through this crisis time of this pandemic. So today we'll be actually discussing about broadly how important it is, the overall healthcare advisory adherence in this difficult time of COVID. And then when we talk of COVID, we also should not forget that even during the COVID, all other non-COVID disorders, non-COVID health problems, they are not remaining silent. So they are there, they are already existing. Over and above that, for the last 16 months or 18 months, we are also having an additional problem of COVID. Now, one is adherence to COVID advisories relevant to COVID-19. The other issue is that how the COVID-19 pandemic situation, it is influencing our adherence to the health advisories, healthcare advisories in reference to the management of all other diseases, non-COVID diseases, how they are being actually compromised. Adherence of healthcare advisories for the non-COVID disorders, okay, or for other kind of healthcare needs, how they are being affected, how they are being adversely affected. We'll also try to discuss some of them. Broadly speaking, our discussion today will be actually centering around 4 sub-themes, and these are, broadly we have discussed about what we mean by adherence, and then why it is important, why there is a need to redefine this concept of adherence during this pandemic. We have just discussed that. Besides, we'll also be discussing about the fast changing knowledge base, okay, of COVID-19 management and the challenges in its translation to practice. So when we started this, when we were actually thrown into this pandemic in the early part of the last year, we were actually clueless, okay? We didn't even know about this disease. It took us a little time to understand the disease pathogenesis, okay, the causative organism of the disease. And then what could be, we didn't have uh, any treatment, any specific treatment to treat the disease. But then gradually through trials and errors, we came to know about the therapeutics of the disease, the diagnostics of the disease. Okay. And then we also have quickly could realize that for containing this disease, we need to have a good vaccine. So very soon, in a unprecedented speed, we could develop different vaccines using different vaccine platforms. We could develop in record speed. We could develop a good number of vaccines which are globally available. And but then we find that it's not enough to just develop a new vaccine. It is also important to arrange situation whereby we can vaccinate everybody. And then when we talk of vaccination, then also the people we need to vaccinate, okay, they should have also come up, number one. And on the other hand, the vaccine should also be available. So there is in broader sense, you would say that the circumstances and situations which are conducive to vaccination, that is also to be created. And all these are actually linked to adherence of the advisory. It is not enough to say go and get the vaccine. The vaccine has to be there. The person who is going to be vaccinated are also should be willing to get the vaccine. The vaccine should be efficacious and safe simultaneously. So all these is actually revolving around the broader sense, the concept of adherence about the general advisory about the COVID management, whether it is treatment or therapeutics, whether it is diagnostics, whether it is the chemoprophylaxis or trying to prevent disease using medicines, immunoprophylaxis trying to prevent the disease or the disease severity and the disease fatality. But in all these cases, we need to actually religiously follow this. But at the same time, there are crises, there are challenges that the evolving nature of the disease and the constantly fast changing advisories that also sometimes keep making the public and even the doctors, the medical fraternity, are put at bay. And to a certain extent, sometimes maybe also they are getting a little confused. And that's the reason also that is creating some problem with the good adherence to the advisories. And finally, we'll also be discussing a little about the adherence challenges in non-COVID healthcare practices, how the different non-COVID healthcare practices, their adherence is becoming a problem. That also we need to discuss. And finally, we'll also discuss the adherence issues in COVID appropriate behavior guidance and vaccination. Now, these broadly, all these will be summarized by in one presentation, formal presentation, brief presentation, maybe 20 minutes or so, by Dr. Shambho Samrat Samazdar. And then we'll be having some discussion on that presentation, and we will encourage all the people who are there, who are listening to this session. I would request, whenever you have any question, any query, any confusion, you can please type in the chat box. And after this 20-minute or 22-minute presentation, Dr. Samazdar will take those one after another. We'll start discussing that to the best of our ability. So this is the plan. It is just not more than, say, overall 60-minute session today. We have already into some 20 minutes. We may go a little more beyond 60 minutes, maybe 70 minutes we can have. So 20 minutes are gone. The next 20-25 minutes will be Dr. Shambho Samrat Samazdar, who will be mainly talking on these areas as I just discussed. And then we can have the general discussion and question answers. So thank you very much. We look forward to a very interesting discussion. And without standing between you and Dr. Samazdar, I hand over to Dr. Shambho Samrat Samazdar for his presentation. Over to Dr. Shambho.
Thank you, sir. Thank you for this nice introduction to this topic, that is adherence in the times of COVID-19. And as Sir had described adherence, that is the extent to which a person's behavior, that behavior can be taking medication, following a diet, or executing any lifestyle changes, and that should be corresponds with agreed recommendations from a healthcare provider. And I must thank our organizer, the InnovoCare Health Solution, specifically keeping this topic or on adherence in this particular day, today, 31st May. And we all know that this is the day, No Tobacco Day. And no tobacco is one of the very important, I can say, the lifestyle changes which need a very good or strong adherence in uh, many patients. So I want to thank again the organizer, specifically Mr. Rohan Tripathi, to organize this event in this particular day. And hopefully uh, the viewers who are now watching us uh, will ensure that they will be adherent to non-smoking behavior. Now coming to the topic, and to discuss this topic, I had a plan to talk on this particular areas, that is number one, adherence to different non-pharmacological prophylactic measures, adherence to vaccine against COVID-19, what are the challenges in adherence for telemedicine COVID care, as this is one important area by which we are providing our services towards patients. And as Sir had mentioned, the non-COVID care is extremely important, and we should not miss uh, the, the, the care in this area, because as now we are facing COVID-19 pandemic, it is not like that the diabetes patients, the diabetes disease is getting vanished, or hypertension, there is no hypertension patient like that. So we need to take care of newly diagnosed diabetes patient, newly diagnosed hypertensive patient, and also the patients who are diabetic, who are hypertensive, who had some other disease. They require some chronic care, they require their treatment. So what are the issues regarding that particular disease adherence, that will be discussed in nutshell. So what are the non-pharmacological prophylactic measures? Among them, the SMS is very important, and SMS is the thing that can prevent the waves of COVID-19 pandemic. And what are that SMS? We all know that social distancing or safe distancing of around 6 feet, and now there are some concepts are coming of that, revising that distance from 6 feet to 10 feet, but at least till date CDC recommends, our government recommends 6 feet distancing. Then the mask protocol, will go in details on this protocol, because mask is very important. So we can say mask, this aim is savior of another aim, that is mankind. So we need to reinforce, we need to have some strong regulation regarding this mask use, and obviously another S, that is the sanitization. But again, I am saying, as this COVID-19 pandemic, or we can say this is such type of virus which generally transmits through through droplets, through some airborne concepts are there. So mask should be wear all time. We will go in details the specific recommendation by different government protocols. We will go in details. Another issue is testing. To to detect the case is very important, and after that the contact tracing, that can prevent this pandemic thing, and rightly isolate and quarantine our patients and their relatives. So there are some confusion in us, among us, that what is isolation and what is quarantine. So generally, while I was in my community medicine classes during my MBBS time, so I remember like that I for infection. So if someone is infected, they need to isolation. So if I am infected with COVID-19, then I need isolation. And who are quarantine? Quarantines are those, they are not infected. So my family member or the persons with whom I had some connection, they are not infected or not known to be infected. So they should be quarantined. So this protocol, there are some specific protocol nowadays. Isolation period is at 10 days from symptoms onset, or if a person is asymptomatic and become COVID-19 positive, so generally it is recommended that it is 10th day from the RT-PCR testing, and the person who are symptomatic, from symptoms onset it is 10 days, plus there should not be any fever or worsening symptoms for last 72 hours, then we can end the isolation. So these things are important, and these isolation and quarantine protocols we should be we should follow strictly. And PP, while we are doing, specifically us healthcare professionals, while doing high risk things like taking nasal swab or going to see positive patient, COVID-19 RT-PCR positive patient clinically, or doing some intubation procedure like that. So that time we should use this PP. And lockdown, it is again a approved method, though there are some economical barrier against lockdown, and there are some social issues with lockdown, but definitely lockdown has a role in prophylaxis of COVID-19. So as initially we had talked about mask, I just want to re-emphasize mask, because this is one thing along with vaccine that can really challenge this COVID-19 pandemic upsurge or waves. So this was the message that has been made by NIH director. Well, if people are not wearing mask, then maybe we should be mandating it. So at the time of 23rd October, they had the director told that, and the CDC director, he had made this comment: these face masks are important, powerful public health tool we have. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine. So there are some controversy with this comment, obviously, which type of mask and whether this type of statements is going against COVID-19 vaccine concept. There is a debate, but I must say that mask and vaccine, they are synergistic in nature. So we need to ensure there should a regulation for universal masking, properly fitted masking. So why mask is important? What are the sciences behind that? So do mask reduce viral inoculum to which wearer exposed? Yes, it is. So there are evidences from virological, epidemiological, and ecological studies that if we use mask, then the viral inoculum or dose that actually decreased. And we know different types of mask. N95, that means at least 95% viral particles can be filtered. And if we use 3-layered surgical mask, it can filter 65 to 85% viral particles. But again, the cloth mask now not that much recommended, and it is generally recommended if we are using properly fitted cloth mask, then obviously it is better over that if we can use one surgical mask that can give us better protection. And mask is something which is not, if I am wearing, that is not enough. All the person should wear mask, then we can prevent this transmission. So as we are talking about that, whether if we can reduce the viral inoculum dose, whether it can lead to less severe disease. So way back May 1938, it was published in American Journal of Hygiene. If there is, you can see this picture. So if we can reduce the viral inoculum dose, so that will lead to less severe disease. And whether it can be translated in SARS-CoV-2 also. There are some animal model with Syrian hamster. If they are exposed with higher dose, the hamsters become more sick. And this model also seen in the ferret also. So if we use mask to that hamsters, whether that can give some protection, so animal experiments. So surgical mask partition reduce the risk of non-contact transmission in a golden Syrian hamster model for COVID-19. So in case of COVID-19, it was proved by animal models. So can give human increasing doses of SARS-CoV-2 if we use mask. And masked and unmasked hamster models give various doses, and masked hamsters less likely to acquire SARS-CoV-2. And if even acquire, they have more mild disease. Human experiments on this model is very rarer due to ethical issues, but some previous experiments that suggest that relationship between inoculum and disease severity. And here we can see one wild type influenza A model, virus model in healthy human volunteer that suggests if the patients are wearing mask, that gives less severe disease. And that is why we had published one article in a journal, and you can see this headline that comes in the Times of India: mask is the best weapon to fight pandemic. But we had also mentioned that mask and vaccine, this is very important. This M and V can prevent us from undergoing another MV, that is mechanical ventilation, so or getting severe disease. So mask and vaccine is very important. And this was our paper that was published in JIMA. And mask for all, physical and it is not only a physical barrier, it is an immunological barrier. Just like a type of vaccines, it also increased our immunity against COVID-19. So this was published in JIMA. Now coming to another take, we had talked about mask, and regarding mask, another important issue is when I am diseased, when I am affected with COVID-19. So what is my role, or what is the role of mask for me? As I am now isolating in one house, this is clearly from recent recommendation from our government of India isolation protocol, that if I am affected with COVID-19, I am in home, then I should wear a 3-layer surgical mask all time. And that should be changed 8-hour interval. And another important issue is that ventilation. The room in which I am staying, that room should be well ventilated. And the persons in my house who are accompanying us, they also should use mask. And that mask, when they are entering into my room for any help, they should wear one N95 mask, and at that time I also should wear N95 mask. So this is very clear cut in our guideline, and how one COVID-19 infected patient should use mask, should adhere this mask protocol, that has been nicely depicted in our GOI protocol. Now coming to the vaccine and vaccine adherence, that is important. As always, I had just told that this MV is important for protection against another MV, that is mechanical ventilation. So mask and vaccine is very important. Vaccine, if we are non-adherent to vaccine, that will create big problem. And you can see, this is one paper published in Lancet, and this paper includes around 32,000 English men and women. So it was found that at around 20% of them have negative attitudes towards vaccines. And what are the general portions, or we can say, what are the main cause of negative attitudes towards vaccines? Number one, general mistrust of vaccine benefits. So they have some mistrust with vaccines efficacy or effectiveness. They have some worries about unforeseen effects. They have some concerns about commercial profiteering. And many of them also prefer for natural immunity or herd immunity. And we all know that this is, yes, this herd immunity can be a tool for getting our population immunized. But the problem with COVID-19 is that COVID-19 is such a disease which is very much unpredictable in nature. So scientists are calling it a predictably unpredictable disease. So we should not sit and wait to get our community to have that herd immunity, because for the sake of herd immunity, we lost many people. So now next topic, that is the adherence to telemedicine COVID care, as we are providing our patients telemedicine care. So number one issue that is important, and very important, I must say, that is the history of the disease, and specifically the symptoms onset. Many people, many patients tell us that I have fever for 3 days, I have cough for 2 days, so my illness is now for 3 days. So what should be done? It is our duty to ask that particular patient whether they have weakness, muscle pain or myalgia for prolonged duration, maybe 5 days, 6 days, like that, to understand the onset of symptoms, actual onset of symptoms. Because this actual onset of symptoms help us to understand in which state the patient is now belonging. So we all know that generally in COVID-19 natural history, there is a viral phase, viral disease phase, then there is a pneumonia phase, and there is a inflammatory phase or development of cytokine release syndrome. So if we can understand or pick the right point, that at which phase the patient is now belonging, that can help us to treat the patient accordingly. So this is one important issue, and regarding that telemedicine care, we need to be very pinpointed regarding this question. Next issue is saturation and respiratory rate. It is now we need to ensure the adherence from the patient side, patient's relative side, that they are checking their pulse oximeter readings in regular intervals. They are checking the respiratory rate rightly. So this is very important. Lab tests are very important again for COVID-19. Though it is not that recommended in mild or asymptomatic patient, but sometimes it is important to give emphasis on the blood reports like CRP, D-dimer. These are the very important tests, and complete hemogram, neutrophil lymphocyte ratio. So it is our duty to check periodically the test report along with correlation with the clinical symptoms. So again, the lab test, the patient, we expect that patient should be adherent to the prescribed lab test. And there are some again confusions regarding HRCT thorax, and sometimes patient will tell us, please do my HRCT thorax, and at the time when there is a symptoms onset, maybe for very early symptoms on onset, 1 day, 2 days, 3 days, like that. So it is our physician's jurisdiction to decide when to do the HRCT thorax, because HRCT thorax, again the patient need to go some facility to do that test, but sometimes it is very important and it can predict whether the patient will go in complication or not. Some moderate disease, we need to decide whether the patient needs steroids or not. So this test is very important, and we need to decide, and when it is absolutely required, the patient need adherence to do this test also. Reconciliation, it is not like that a COVID patient is having only COVID-19 infection. The patient may have diabetes, may have hypertension, may have COPD, asthma, like that. So we need to reconcile everything. We need to reconcile their ongoing care. So this is again an important area we need to give emphasis. We need to take the past medicine history, and according to that we can prescribe. Home isolation protocol. So as already we had discussed about how we should use mask in the home, what is the duration of isolation, that already discussed. But again, there is challenges with that also, because many patients in our socioeconomic background, it is very difficult to maintain isolation protocol. So we need to take care of them, and for that our government making different safe homes. And this is very important. As always, we talk that science is not a static thing, it is a dynamic thing. So there is newer evidences are coming up daily, and our management protocols are changing. So we need to cope up with that. We need to be adherent with that also. This type of webinars are now going, and from that, those webinars we are learning daily. And our documents, our the government protocols, their recommendations are changing day by day. Very recently, there was in AIMS protocol, AIMS ICMR protocol, there is a change within 3 or 4 days. So 1st May there is one, 3rd May there is one first the protocol change. Then 17th May there is another protocol change. Then again, very recently another protocol change by Government of India. So there is some protocol changing happening, and we need to be very adherent to that also, adherent to that dynamic knowledge also. And follow up. Follow up is very important in this type of COVID care. Very recently, I had one bad experience with this type of thing. I had prescribed one particular patient for COVID-19 management, and I also prescribed what are the tests to be done. But the patient not having follow-up, the patient feeling that he is better, so continue my medicine and never do the test. And after 30 days, her son called me and asked me that her suddenly the mother having a very low blood pressure and feeling very sick, what to do. So I asked, what is the blood pressure? He told me it is around 70/40 and saturation is around 78%. So I told him immediately admit her. So he had admitted that particular patient, but unfortunately that patient died after 3 days and put in a ventilator. And her HRCT is totally wide. The CT severity score is 22/25. Imagine this. I am not telling that even if with good follow-up, the bad outcome may happen. But follow-up is important. Follow-up is very important and key to get success in COVID-19 management. Now coming to the adherence with other diseases and other chronic diseases. So this is one cartoon that has been taken from one paper published in a Journal of American Family Physician. Here the role of community pharmacists they had mentioning, they're giving stress, but I think this is the role of family physician in our country, because community pharmacists generally not present in our country, and which is a very important job in their country. But family physicians are one of the most important tool to help our COVID-19 patients and other patients. So there are some areas like patient with chronic disease and how to support them. Number one, supporting rational medicine use, promoting medication adherence by talking with them, giving confidence with the medicine and taking them. Just giving one example, that if a patient not getting insulin or not taking insulin, please make them understand that insulin is important to you, because if your fasting plasma glucose is more than 126, then you have 10 times more chance to admit in one ICU compared to those whose fasting plasma glucose is below 126. So try to make your fasting plasma glucose value below 126. So this is very important, and this knowledge, if transmitted from family physician, then that promote medication adherence, insulin adherence. The medication review is important, not like that this is for last 1 year, 2 year, the patient will take same medicine with no follow-up. So this we should ensure. Maybe using this telemedicine platform, we can improve this medication review and follow-up. Chronic disease medication availability, that also very important, because nowadays we are facing big problem in this area. Initially there was some problem with insulin, but now it is short. But there are some other drugs that is not available regularly, so we need to alternate, we need to use alternate medicines. Maybe the same class drugs, just like we an example, if a patient is not getting a specific insulin, we need to give another insulin almost having similar type of pharmacokinetic or pharmacodynamic properties. Triaging at the community level for suspected COVID-19 cases. So this is important. And information and communication about COVID-19, always we need to increase health literacy among our community level. So this is one paper in India, from India, published, because we all know that glaucoma is one very important disease in the ophthalmology. And you can see here what is the impact of COVID-19 on follow-up and medication adherence in patients with glaucoma in a tertiary care center in South India. So 57% of the patients were found to be non-adherent to medication. And maximum cause of this is non-availability of medicine. Yes, there are some other causes like financial issues, did not feel much improvement with eye drops, like so on. But you can see, apart from COVID-19, there are some other issues. Lockdown restrictions, that cause is only 2%. But maximum cause is non-availability of medicines and financial issues. So this is our duty, how to ensure the other medication to be to the patient should get other medications, and if there is any availability issue, we should use alternate drugs. And as COVID-19 pandemic and diabetes has a very bad combination for our patients, so we need to emphasize this disease specifically. And what are the concerns during COVID-19 pandemics for diabetics? A beautiful paper written by Chawla et al. They suggest that number one, the restricted movement, reduced access to healthcare resources, medication and glucose strip unavailability, missed follow-up, laboratory tests. They have a fear that if I go to laboratory, I will catch up COVID-19, and less visit to healthcare professional, restricted time for interaction that generally help them to understand the disease pathology, and that help to train themselves with different types of medications, because in diabetes insulin education is very important, and if there is a lack of time for interaction, that will directly affect insulin intake. So this is again another issue. Challenges with remote monitoring of blood glucose level and lack of adequate troubleshooting. That means correction of injection technique and use of insulin device. Many times, pre-lockdown or pre-COVID time, the person who regularly visit to those who are taking insulin, and they make them understand how to use insulin. But due to this pandemic, this whole system become deranged. So that is an issue we need to take care. And for that, there are some solutions like video demonstration of proper injection technique. Prefer the insulin which requires less monitoring. Maybe we can use those insulin which has lesser chance of hypoglycemia. And sometimes it is important to initiate insulin via the disposable pen. But again, I am saying, many of our patients are not that much tech savvy. They not understand that smartphone. So this is an important issue, and we need some answer to that. And for that, these are some recommendations done by them. I am not going in details. That can be done in separate day. How to initiate insulin during COVID-19 pandemic. There are some issues. If we can just use one basal insulin in a low dose, like 0.1 to 0.2 unit over telephonic consultation or video call consultation, that can help us. That can help our patient for prevention of hypoglycemia and to get optimum glycemic control by self-monitoring of blood glucose. And as per their self-monitoring blood glucose result, they can up titrate or down titrate the dose accordingly. So it is always important to be simple for improving adherence of the patient. And this is similar to this COVID-19 pandemic also. And what are that? Simple, That means simplify the regimen. We need to emphasize how to prescribe us a regimen which is very much simplified. I am not criticizing, but there was lots of prescription with one drug. I want to name that favipiravir. And that favipiravir, you know how many tablets the patient need to take. That can ruin patient mentally also. And we all know that favipiravir had very less evidences till date. So we need to provide some therapeutics, using some therapeutics by which the regimen can be simplified. Imparting knowledge is important. Informed prescribing is important. Need to modify patients' beliefs and behavior. Provide communication and trust. And for that, we may use some simple study reports to them. And obviously, we should leave the bias and again reevaluate the adherence is very important. And evaluate adherence. Apart from that, evaluating adherence again, 1E is very important for having better adherence, and that E is empathy. Our attitude towards patient, that is very important, and that can help to increase adherence. With that, I want to thank again InnovoCare Health Hub Solution for giving me this opportunity to present this important topic in front of you. Now over to Professor Tripathi, sir. Sir, please.
So thank you very much, Dr. Shambhu. So you have discussed in quite good detail about the issue of adherence, okay, not just for COVID management, but also for non-COVID health situations, health activity, healthcare requirements. Many of us might be knowing that the routine vaccination, okay, particularly last year when we were struck with the pandemic, the routine vaccination really suffered. And from the month of, say, March to the month of, for about, say, 4 months, the routine vaccination, routine immunization program among the young people or the children, particularly the first year of life, which is a routine practice, that took a backseat because of the pandemic. And this was something which otherwise the adherence was a great problem because of factors that Dr. Shambhu has also mentioned. So the pandemic not only had caused a lot of misery and lot of loss of lives in reference to COVID, affliction with COVID-19 and hospitalization and deaths, etc., but it has also jeopardized the healthcare delivery for many other, in all other areas also. We all know for months and months together, many hospitals, their OPD services were also, okay, suspended. The surgeries were also, even today, the elective surgeries, they are getting postponed. The emergency surgery, there are also a lot of confusion. And even the antenatal care that suffered during the pregnancy, the mothers otherwise are supposed to also get routinely the kind of follow-up care in the antenatal clinics in the hospitals, that also had suffered a lot. And all these also have a lot of implications on the overall general well-being and health of people. Okay, so we should also be, the doctors' clinics were closed, many doctors, and there was no other alternative than going to that teleconsultation mode. And as we know, that Government of India had also allowed this teleconsultation, but then teleconsultation has its own limitations. Yes, teleconsultation is application of this new technology. in medical practice. We had no other way. We had to adapt that. But at the same time, we must all appreciate that it has its own limitations, and some of these also has been very aptly discussed by Dr. Somasdar. The one of the great problem in teleconsultation or telemedicine practice is the kind of mutual trust that develops between the physician and the patient when there is a across the table discussion or across the table consultation. That is to a great extent missing in teleconsultation. Besides that, there is also an inherent problem of explaining, okay, to the patient about how to take the medicines, which medicine is to be taken, how with at what frequency, etc. And not to speak of the fact that many of our patients, okay, not necessarily all of our patients will be equally tech savvy to engage themselves meaningfully into teleconsultations sessions, okay. So there are huge kind of challenges and problems which otherwise will impact on the suboptimal adherence. Think of asthma, where or say COPD, where the inhalational therapy, use of the inhalers are so very important, and we all know that how to use an inhaler correctly, okay, that needs to be, the patient needs to be trained properly. In fact, it has to be demonstrated, and then patient should be asked to show how he is going to inhale the drugs. But uh, particularly these inhalational therapy, particularly the asthma clinics, etc., because of the very nature of the pandemic and the transmission of the disease of COVID-19, it has a uh, direct link with the transmission of COVID-19. The kind of the deep inhalation or the deep breath that are involved in case of the uh, use of the inhaler and the demonstration of the inhaler. Because of that, this was also avoided until the time when the OPD services were suspended. Even before that, while it was still going on, so that was actually put to the back seat, as a result of which the management of asthma or COPD, okay, that also has been compromised to a certain extent. In the diagnosis of COPD, the spirometry is so very important, okay, and that spirometric tests are also mostly people have tried to avoid. Even today, it is we try to avoid to the extent possible, okay. So these also definitely have impact. So when you talk of adherence today, when we discuss adherence today, we as a drift from the traditional or the orthodox concept of adherence. Here we are also talking of adherence from an angle where it is not just the 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 abiding, the patients abiding the instructions given by the doctors. It is also the treatment guidelines, okay, to what extent we as care providers, we as doctors, even the doctors, to what extent they are following the treatment guidelines. And in following the treatment guidelines properly, what are the barriers? And sometimes, as Dr. Somasdar has mentioned, that the guidelines are also changing itself at such a speed, okay, within a week the guideline changes from the same authority, as a result of which there is also some amount of confusion among the doctors also, that which one to follow. And many a times when it is being changed, okay, let us take an example of, say, even the vaccination, okay, vaccination guidelines. The gap between the two doses, as it is changing, okay, initially, say, if we talk of, say, Covishield, initially it was 4 to 6 weeks, then it became 6 to 8 weeks, and then it has come to 12 to 16 weeks. Now, as it is coming like this without any kind of explanatory details why it is being done, so there is also it is creating some amount of confusion and some amount of lack of confidence, okay, which is indirectly impacting on the adherence. So these are some of the problems. We are not here to actually criticize how different stakeholders, okay, they are trying to manage things, but then we need to also analyze, and we need to also introspect that if the manner in which we are trying to manage the whole problem, whether nobody is questioning our intention, but then whether it can and to what extent it is actually impacting the adherence, impacting the compliance of the guidelines, that is also something to be looked into. Regarding the use of corticosteroid, yes, if you think of in today's therapeutics, COVID-19 therapeutics, the three things that stood the test of time or that has some evidence is: one, steroid, systemic steroid, that is oral or intravenous; second is oxygen; and the third is about anticoagulants. So far as these three treatment interventions are concerned, pharmacologic interventions are concerned, these are absolutely, you can say, unequivocal. There are huge amount of evidence in their favor. But then again, nobody can say that they are being used in the most appropriate manner. That means when you talk of adhering to the appropriate treatment protocol, whether we as doctors, we are actually following them, okay, in the most appropriate manner. So these are also the questions, and I think the time has come that when you talk of adherence, we need to expand our understanding about adherence, and it is not just limited to prescription adherence, okay, that it is not just only the obligation of a given patient when, as a doctor, if I am prescribing, whether the patient is actually following that prescription and to what extent he is following that prescription. It is also overall healthcare institution or the healthcare delivery system and all the different stakeholders who are actually responsible for delivery of healthcare, to what extent they are actually adhering to whatever is best for the patient, because ultimately it is the patient who is at the receiving end, that for the optimum outcome in reference to the patient's well-being and health, whether all the stakeholders that are delivering healthcare, they are actually adhering to evidence-based advisories. That needs to be seen, and we all must try to see to it that the adherence is optimum. Of course, at the same time, it is also the responsibility or the obligation of the patient, okay, that they remain adhere to the advices that are given. That is particularly relevant when the patients are expected to remain homebound and follow the advices. And there, the doctors, under the current pandemic situation, most of the time, if not all the time, the doctors have also accepted that the treatment monitoring is also to be done from a distance, tele-monitoring through teleconsultation. So that also poses a challenge, that whether it will be possible always for the patient to follow, and if the patient is drifting and if the patient is departing from what has been advised, to what extent that is can be checked and monitored by the concerned physician. So altogether, we must say that yes, it is a great challenge, but it's not true that we cannot make it better. We can definitely make the adherence to the different treatment advisories or different healthcare advisories, not just the treatment. We can talk of prophylactic measures, whether it is pharmacologic or non-pharmacologic, or whether it is vaccine and vaccination. In all areas, there is a need to, even if you think of the lockdown, or say for instance the micro containment measures. So there also we need to, the general mass needs to adhere to, okay, general mass need to obey whatever they are expected to, the guidelines or the orders that have been sent, okay. So that needs to be also, and we see the reward, or we see the good result of more or less, or maybe more or less appropriate kind of adherence in the last, say for instance in West Bengal, since 16th of this month, 16th of May, we are passing through, you can say, if we don't call it lockdown, but some degree of self-discipline is being maintained by the general public. Okay, so and then we have seen at least partly the decline in the infection rate that we see in the last, say, couple of weeks. Yes, to a great extent, I would say that that is because of the self-discipline that the general mass is actually have demonstrated by most of the time, most of the people remaining homebound and not going into a crowd or not making a crowd, and most of the things, most of the of course there are adverse influences on the economic that is there, but then we are helpless in fact, and the good outcome is also very clearly demonstrated that there is a decline in the transmission rate. Okay, so we have to keep this up. We have to, as patients, we need to follow what the doctor or the hospital is advising. As doctors, we need to follow the guidelines, treatment guidelines. That doesn't mean that we have to follow, as doctors, we have to blindly follow the treatment guidelines. But if a given patient requires some degree of tweaking in the best interest of the patient, that is what is called individualization of therapy. That is always there. The doctor is at liberty to do that. But broadly, when a particular protocol, treatment protocol, or a standard treatment guideline is issued by appropriate responsible authority, whether it is the Department of Health and Family Welfare of a state, or from the Health Department of Government of India, or from World Health Organization, or from premier institutes like All India Institute of Medical Sciences, there definitely there is some justification that is mostly that is based on the hard evidence of randomized controlled trials, etc. So if there is no exceptional need, we should, to a certain extent, we should try to follow them. Okay, and that is what is we are saying, that broader meaning of this adherence, that is healthcare advisory adherence. And it applies not just to COVID, it applies to non-COVID ailments also. And because of the COVID pandemic, there are also challenges for the non-COVID health situations. Okay, optimal adherence to be followed in the delivery, healthcare delivery in those disease areas or health conditions, that also are to be analyzed upfront, and appropriate solutions are to be found out and applied. So this is what we wanted to discuss this evening, and I would request Dr. Shambho, if you find certain questions in the chat box, we can now try to answer, address those questions to the best of our ability. Over, Dr. Shambho.
Thank you, sir. I think there is no question till now. Rohan, can you please check whether any question from our Facebook page?
I guess we have already overshot the time limit. This was till 9 p.m.
Okay.
So it's already 9:12. So the questions we can, the few questions that there could be, we can answer them later as we do, and also take some of the medical questions up in our iKnowCare e-Academy platform.
Okay.
So you keep it open. You can give this thing that those who have listened to today's or attended today's session, if they have questions, they are encouraged to put their questions in the iKnowCare e-Academy WhatsApp group, where we'll try to address those questions to the best of our ability, maybe for the coming 3-4 days. Okay. So if we have already crossed the time limit, I think we can call it a day. And Rohan, you can think of concluding the session with your concluding remarks. Thank you.
Thank you so much, dear speakers. So today we were really able to experience a session that truly went ahead with the application of the general use of the word adherence, from typical medicinal adherence, where we aimed at with MedPer, your personal medicinal helper. Our main aim when we started this series was to implicate or make people aware more about the general meaning of the term adherence strictly in the medicinal term. But as we progress with this series of webinars, it's very good to see that it's transcending from a very one place or a singular meaning to a much more diverse meaning of the word. And as a very favorite line of mine, which Dr. Shamatsar had said in one of the previous programs, that if you don't have the medicines properly, it won't help you. So it's very simple yet very straightforward and absolutely honest truth. Medicines or the guidelines or the protocols won't be any help of you if you don't follow them stringently. So I guess that's what we were talking about in very depth and very properly, with proper emphasis on the COVID-19 scenario. We have also emphasized on the importance of today as a no tobacco day worldwide, and the importance of actually kicking the addiction, stopping the addiction, and living healthier lives, adhering to all health protocols, healthcare measures to have a better life, a better world for everyone around. So, with that, I would also like to remind that iNovoCare e-Academy and iNovoCare Health Hub Solutions is there every month at least once with a medicinal adherence-based program. We also frequently have programs based on uh, different medicinal topics. We have continued medical education programs. So all of you are much welcome to join. Please do follow our Facebook page to be aware more about these things. We have recently tied up with My Cool Guru, which is our digital marketing partner, to have a better reach among every one of you. So with that, and please keep eye on the iNovoCare Facebook page. We will be back within this week only with a program on the importance of mental peace and mental health in these times of COVID. So with this, I would like to again thank our dear speakers, Dr. Shamu Samrat Somasar, Dr. Shamuda, who is our uh, friend, philosopher, everything teacher from day zero, without whom this was not to be possible. And also Dr. Shantanu Kumar Tripathi for being a part of today's evening and for the entire 5 sessions and the journey that has been ongoing for the last few years. So with that, and we welcome you ahead of the next session. Welcome you all to the next session of iNovoCare Health of Solutions. And with that, I wish you all a very good night. Thank you so much for joining us. Thank you.
Thank you all.